It's the human heart. This is the anterior view, posterior view. And if you get confused, here's the trachea sitting posteriorly. We have two auricles which sit on top of the external portion of the atria. We're going to open it up a little bit, and we're going to look at the ventricles. We start with the four ventricles. There's an atrium, ventricle, ventricle. So how do you know the difference? Well, right here on the ventricle, you've got a very, very thick wall. And one of the things we'd said earlier was that the left ventricle has to send blood throughout the entire body. Therefore, it has the thicker muscular wall, thin muscular wall. Within each of the ventricles are papillary muscles, and they're attached to the valves leading from the atria to the ventricle by the chorda tendinae. Here are the valves. On the right side is the tricuspid. On the left side is the bicuspid or the mitral valve. We look and we see here is the aorta. This is the ascending. This is the arch. And then we have the beginning of the descending aorta here. Going from the left ventricle into the aorta is a semilunar valve here. We look at the electrical system, and we have the SA node sitting here to the AV node, down the bundle of His, and we have a right branch bundle and a left branch bundle. Here we have the Purkinje fibers, which grasp the muscle, and the electrical stimulus causes it to contract. Inside the right atrium is an indentation here called the fossa ovalis. Fossa ovalis. Leading to the right atrium is two very large vessels, the superior vena cava, and here is a cut portion of the inferior vena cava. The inferior vena cava, the superior vena cava, take the deoxygenated blood from the upper and lower portions of the body and dump it into the right atrium. Okay. Connecting here between the pulmonary trunk and leading to the pulmonary vessels and the aorta is the ligamentum arteriosum. Now, we look at the anterior portion of the heart here, and we see the left coronary artery, which gives off a circumflex artery running this way, and a left anterior descending artery, sometimes called an interventricular artery. Here's the right coronary artery, comes around, gives off a marginal artery, and then runs to the posterior aspect of the heart. We look at the base of the aorta, and these are the origins of the coronary arteries. The right side here, the left side here, and again, once they come off here, we saw they peek through the anterior aspect of the heart. If we turn it around a little bit, we look posteriorly. So again, we talked about the pulmonary veins and the pulmonary arteries, and we explained why they are what they are. Here is the great cardiac vein leading to the coronary sinus, which dumps into the right atrium. We have a small cardiac vein here. We have a middle cardiac vein and a posterior cardiac vein. These are dumping into the coronary sinus, which then goes into the right atrium. Okay. We then have posterior interventricular vessels, right? And then you come off, this was the right side. Remember we did this. Right? We did this. And here's the right vessel with the marginal coming all the way around posteriorly. Same thing here. Here's the circumflex coming around posterior artery. inside great vessels are semilunar valves. Semilunar valves, okay? Different, remember we said that, and I'll just show you on this model because it's easier. This was the right side, so this was tricuspid, this is bicuspid or mitral. Well, inside here, coming from the right ventricle, is a semilunar valve which leads to the pulmonary trunk. Here is a semilunar valve coming from the left ventricle leading into the aorta. Okay, so I think that covers it for now. And then again, there are other smaller things which are in the supplement that we can go through afterwards, but you have to know all of the 79 things that are listed there. Okay, good.